Welcome to the Trauma-Informed Lens podcast. I'm your host, Matt Bennett. Each episode we talk about the research and practical aspects of the trauma-informed movement. This podcast is not designed to replace mental health services. If you feel uncomfortable or triggered by our discussion, please consider seeking your own trauma treatment. In no way is seeking treatment an admission of weakness. It is a chance to build resiliency and experience post-traumatic growth. You can find show notes, resources, and more at traumainformedlens.org. Welcome, friends, to the Trauma Informed Lens podcast. I'm here today with two very, very special guests, Bobby Watts and Barbara DiPietro. Barbara's actually been on the podcast before talking about advocacy, and as part, and I shared this with my listeners last episode, is, obviously we're struggling with a pandemic, and now there's this big social justice movement. And as a white man, I'm trying to figure out how I can be the best ally in this movement. Part of that is shutting up and listening and learning from folks. And part of that is trying to share my platform with some guests that can bring, I think, a level of depth and expertise to this subject and what's going on in our communities that I think will be valuable for our listeners. And the fact that I got both Bobby and Barb, I combined your name there. You're Bradalina to me at this point. Bobby and Barbara are two of my big role models. Barbara, Barbara's one of those people I met professionally in Seattle. We kind of bonded at a ride to the airport after a regional training for the National Healthcare for the Homeless. She's almost become a sister to me, as such a dear friend, and she's really helped me find my voice. So I'm always happy to share this platform with her. For me, I didn't see advocacy necessarily as part of my work as a therapist, a helper. And boy, now I see advocacy as a part of everything I do. Bobby, the best thing I think I can say on this topic with Bobby, though I respect him on so many dimensions, is Bobby has that voice. Bobby gives you goosebumps when he talks. I've never been able to, certain people have it. Barbara's got a little bit of it too when she gets all worked up at a rally, but Bobby always gives me goosebumps when he talks because he brings a really powerful message, and he does it in just one of those ways where if you're not listening and Bobby starts talking, you kind of sit up and pay attention. And so these are two of my big teachers, and both leaders in the National Healthcare for the Homeless Council. So, Bobby, I'm going to let you introduce yourself a little bit first to our audience. And I'd like it, with that introduction, for those of not familiar with the National Healthcare for the Homeless, Healthcare for the Homeless really sits at the epicenter of both the pandemic coming in, because they're working with the most vulnerable populations. And as Bobby and Barbara can both tell you, social justice, health equity, all this stuff is so central to the mission of the council. So as an organization that sits just at the epicenter of these big moments in time, they do that. So Bobby, I want you to introduce yourself, and what is it like for you as a leader in social justice, as a role model for so many of us and a national leader in this epicenter? My follow-up question to your introduction, what do you see out there? What it's been like to you to be these two huge things that we're dealing with in our communities right now?
Sure, I'll be glad to take a stab at that. But first, I just want to say thank you very much, Matt, for that overly generous introduction.
Not at all, my friend.
For the honor of being here with you and with Barbara and with your listeners. And it's a real honor, and I'm really pleased and glad that I can be here with you. So what has it been like? It's been unlike any other year that I remember in my professional life. We started with the pandemic, and what was interesting about the pandemic, besides its unprecedented scope and how it has impacted the world in terms of in our lifetimes and shutting down economies, was very early. People and started addressing the fact that this was not hitting all communities equally. And while we know that happens, and we talk about that a lot in homeless services, we talk a lot about that sometimes in the healthcare services, this really went out into the mainstream, and people were talking about this is the result of systemic inequalities that have been in our health system, been in our society, been in our housing system, pre-COVID, and COVID exposed them for all the world to see. And so it was kind of important that we were hearing this in mainstream media, and then politicians picked up on it. So we've always talked about in the last 20 years about health disparities, but the focus was often on what is wrong with an individual community, or what is wrong with a person's behavior. And this focus shifted with the pandemic, that no, African Americans are dying at 2 to 3 times the rate because of systemic inequalities, less access to health care, more crowded living conditions, because of the government policies that created segregation, locked people out of good education when it's funded by property taxes, which locks in inequality so that the wealthier get more advantages. So this became part of the conversation. And the council, fortunately, we had been dealing with wanting to take a close look at systemic injustice for the last, always, but especially in the last 2 to 3 years. We changed our mission statement, and so it begins with grounded in human rights and social justice. We wanted to say this is what we are all about, and it goes on to say that the mission of the council is to create an equitable, high-quality healthcare system, and then it goes on, the last part of it, as part of the movement to end homelessness. So we had been doing some work around anti-racism, about structural inequities. And so we were fortunately ready to switch to that lens, or excuse me, to really magnify that lens, because we were applying that lens to the COVID pandemic. So when our community health centers, healthcare for the homeless programs and medical respite programs were coming to us for advice, or we were going to them to find out what's happening and for advice, we could apply that lens, and they could apply that lens. And we were able, when speaking to the media, to always point that out, that COVID has addressed the pre-existing conditions, so to speak, in our society that have impacted poor people, but especially African Americans, Native American Indians, and in some locations, Latinx communities and Asian communities. But when we see such high rates in the Native American Indians community, you cannot just, you understand it's because of the conditions that they are living under. And we understand that's because of the policies and the inequities, the unequal, the injustice of this country towards the indigenous population, as well as with African Americans. So that's a long answer to what it's been like, but so it's been unusual to see that addressed at the very beginning. And then of course, with the murder of George Floyd in such a public way, that just lit the tinderbox of people. It's not just George Floyd, it's George Floyd and Ahmaud Arbery, Breonna Taylor, Trayvon Martin, Eric Garner. It was just one, it was like the last one in such a violent, graphic way that now we hear mainstream politicians, Republican politicians, talking about we have to address systemic injustice, systemic racism. It's always been there, but now people are willing to talk about it. And so it's thrilling, it's exhausting. And it can be depressing. It can induce tears, and it can also induce hope. So it depends on what's happening, and just what are your inner reserves, and how you can approach the situation, being honest with yourself. I can address it today. Some days I can't. I just need to grieve.
Beautiful. Thank you so much for that intro to get us rolling. Dr. DiPietro, sort of same question to you, a little bit more of a formal introduction. And what have you, I know you work with providers from around the country. So kind of what are you hearing? What sort of are you kind of at least helping people to think about everything going on in our communities right now?
Thanks so much, Matt, for having us here and for this discussion and for your wonderful introduction. Thank you, brother. As a healthcare and homeless council, we really just for 30 years really have just been focused on some of the structural causes of homelessness, and the social determinants of health is how we've traditionally focused on this. And so this is not just working at the intersection of housing and healthcare and homelessness. I think has put us in a unique position to really be a voice for frontline workers, healthcare workers who see what injustice looks like in their exam room, in their office room for their behavioral health visits. We see what encampments look like personally. And we are aware of the injustices and what that looks like to the human beings that we don't only care for as doctors and nurses and therapists and case managers, but we also care about. These patients are our family, and they are people we care for as human beings in the world. And I think what's been illuminated, not just for us, but for the entire country, is the exact disparities that Bobby just talked about. And for so long, we've talked about the disparities from from more of a housing status. We would compare people who were homeless from people who were not homeless and their health status or their outcomes or their rates of diabetes or what have you. And I think what this has really challenged us, as well as a lot of other organizations, to really go deeper into that and look at racism specifically as a cause of homelessness. And so I am excited about what I'm seeing happening right now. I think for the last 4 months, everyone that I have talked to, no matter what HCH they are in, goes between being completely overwhelmed and completely inspired. And you can go between those two poles 4 times or 100 times in one day, because it was really impressive to see how our providers pivoted on a dime to be able to meet the challenges that COVID presented for us in our clinical spaces. And so it's a testament to the HCH community on how flexible and responsive and determined we are to make it work no matter what, because we're used to working in broken systems. And COVID has really just smashed it more. I could also argue the system's not broken. It's actually working exactly as it was designed, so we can have that discussion too. But really just thinking about, we're used to seeing the injustices right in front of us every day. And now those injustices have exploded for the entire country to see. And this is an opportunity for us to push not just the justice work that needs to be done, but to translate the words and intentions into specific actions that are addressing systemic changes that are needed. And so I worry a little bit about getting lost in rhetoric and not seeing much legislation moved and get signed that changes the institutions that create these disparities.
Well, and I want to, boy, there's so much good stuff here to talk about. I wanted, because one of my, and I'd love to get your thoughts, because I can't let what Barbara just gave us, Bob. I can't let it go. So I've got all these questions. So this idea of, because I think I know the three of us have talked about in different ways. I hear when you guys talk to audiences, it's first kind of, and I do this with the trauma work and the trainings I try to do, is bring knowledge to a subject to enact change. And that's where Barbara really changed my whole way of thinking about what I was doing is, oh, you're an advocate for change. And then trainings became part of that advocacy more than just training for knowledge acquisition. Here in Denver, I do want to share with the audience just some remarkable stuff, because we were one of the first states to pass a fairly aggressive police reform bill. And that happened within maybe I think it got through our legislator and our Colorado out west. You just got to drop anything you think about state governments because we do everything different out here. But I mean, it was like in a couple weeks that was on the governor's desk and signed. And then there was this moment that I think when we look back, it might just be a local moment for us, but there's this school board member and he's sort of become a leader for us here locally. And he put a tweet out on a Thursday night to say, we have a neighborhood called Stapleton that's named after an ex-governor who was also a member of the Klan. And he says, we're coming there next. By Friday morning, the neighborhood committee, who'd been struggling with this issue for several years, said the name is gone, and they started taking the signs down. So I wonder if any of, but I've been, so in some ways I see that we have an energy that in my lifetime, I don't believe we've ever had before. And I wonder how for maybe some folks that are out there on the front lines doing this work, do you have any advice of how to take this energy and maybe just put a magnifying glass on, issues that we know would impact a lot of this stuff that we see walking into our shelters in our clinics each and every day? I just wonder if, kind of throw it out to both of you, because I know it's a tough question. Any thoughts on that? Because we're seeing it a little bit here locally.
Wow, there's so many ways from which we could attack that question. So I'm going to try this angle first. I mean, it's so important that we move. Words are important, and symbols and names are important, and it's really important that we address that, like the names and the monuments and so forth. But we can't stop there or let us think because we've done that we have really achieved lasting change. So my biggest concern, like you, and I don't remember a time in my lifetime where I've seen so much energy around constructive energy around potential reform or structural change. And one of the things that strikes me about being different about this moment than previous moments where I'm old enough to remember, I don't remember the civil rights movement of the 60s, which may have been comparable, but from what I do remember, seeing so many, and I'm African American, so many white people and especially young white people involved gives me hope that we might finally be able to move beyond good intentions and good words to action. And what it will really come down to is really, will white allies, will those with privilege be willing to give up their privilege to effect a more just and equitable society? And the jury is still out on that. I mean, I've lived all my life in New York City until I moved to Nashville for this position 3 years ago. Liberal, highly educated, rich New York City has the most segregated public school system in the country. And I've been around the periphery of some of those discussions where we're saying, let's bring people from a poorer, Blacker, more Latin community. Let's bring some of those students into our schools. And you hear all of the sophisticated reasons of why that should not happen, why that's not a good idea. But really it was, we have a good thing. We are supplementing it with our extra funding for those public education, and we don't want to share that. To me, that's what it sounds like. So, and that's just a small microcosm of one small thing, but in so many ways, if we're going to effect structural change for structural justice, it means people who have gotten privilege and a station that they did not earn and therefore do not fully deserve are willing to share and lower and equal the playing field by being equitable, by giving up some of their privilege. And because it's young people, I hate to say it, but my generation, I've largely don't know if they've reached a certain stage of how open they are to really doing that. but because it's younger people that I see at the vanguard in many cases, I'm hopeful that if we can get this, if they can get this right, and the older ones of us can support them, not necessarily lead them unless they need leading in particular areas, but support them, then maybe we can bring about the real change or move towards some of that real change that we need.
Yeah, great. Well said. Barbara, I want to kind of ask you the same question. I mean, and again, it's hard to even celebrate this in 2020, but Mississippi looks like it's going to change its flag. NASCAR's been, I mean, there's some things, again, it's on one hand ridiculous that we're saying this in 2020, but on the other hand, if we don't celebrate these accomplishments, you know, I think that gives us some energy to move on as well. So you've got all these sort of big symbolic things, statues coming down, all these things. Is there any way, Barbara, that you kind of thought about is how do we bring that down maybe to our level? If somebody's like do healthcare for the homeless, working at a shelter, in a shelter system, even child welfare, educational reform, you know, do you have any idea that now all this brilliant advocacy work, there's like this huge hurricane at your back for maybe a second, maybe a month, whatever it might be? Have you thought about how we might be able to maximize that to further the issues we see in our community?
I have, actually. I think about this a lot. It's coming back to the symbols that we've talked about, pulling down statues, changing our flags, the words of our state name, things that have galvanized attention. These are exciting things to look at, and they're tangible. You can see, and there's an excitement of everyone, you know, protesting and pulling down that statue. But what happens? How do we translate that energy and that action into our houses of legislative action? How do we translate that action into our mayors and our county and city council representatives? How do we translate that action into Congress and to the administration? And I think this is what I think about is the slog of structural change. It doesn't look sexy. It doesn't look like, you know, now it can be fun. You know, I mean, I think advocacy is a lot of fun. I think meeting with your elected officials is fun, and speaking truth to power is fun. That can be really intimidating for people though too. And so thinking about, I see my job in some ways is to pull that intimidation off of folks, is to pull that fear away of speaking truth to power, and really being mindful in not just speaking your truth, but seeking that power out specifically to speak your truth and to make sure that there's accountability for that truth. And so I come back to, how are we translating this moment where we have so much energy and desire for change into something specific, and going beyond the symbols to something that's tangibly relevant to not only people's lives now, but then tangible to people's lives going forward. And so I think about, how are we battling for a more just and equitable healthcare system? Like, this is the opportunity for us to really push single payer and a Medicare for all system that is equal and fair and yields better outcomes for all Americans. Housing goes without saying. How are we really demanding an equitable housing plan for this country that recognizes that African Americans are 40% of the homeless population in this country, but only 13% of the general population? That's not an accident, actually. That was by design. We could go through all of the sectors. True substantive change looks like, what do minimum wages look like that buy you the life that your family deserves? What does the pursuit of happiness look like at $8 an hour? I argue it does not, you know? And so how is it that we're really connecting the values of our society and the values that we are getting increasing attention on into the values of our budgets, the values of our policy proposals? And so, I mean, this goes beyond housing and healthcare and income. It's education, our employment system, our criminal justice system, getting a progressive taxation system that actually represents, you know, people paying their fair share. and having that be distributed in a way that is fair and equitable in this country, so that working families have the dignity of being able to actually have a decency of living that we would want them to have in this country. And that goes for all families in this country. And so so coming back to your question about how do we translate this to the front line of HCH and how we incorporate this action agenda with the actions that we're taking every day to deliver the best quality care we can under very challenging circumstances. And so I would say that when mayors show up and proclaim that Black Lives Matter, we ask, how do Black Lives matter? What will you do? Be specific. When your congressional representative shows up and says Black Lives Matter, now people are falling all over themselves to say it. And a minute ago, it was like those words had no meaning at all. So how is it that we press people to be specific about what they mean and to leverage the power that they do have toward this greater change? And so that's kind of an elected official, kind of people who are in policy-making positions of power. And then coming back to what Bobby said about what's the role of white people, just like our friends and family. As a white woman, how is it that I'm taking responsibility, not just in policy action to press my elected officials for doing something, but how am I raising this with my friends and family? How am I continuing a conversation about racism and justice in this country with just people in my life? And I think that there's a lot of different ways that we can be engaging in this conversation, both from a structural policy perspective and as a way of such a community conversation that's really available to all of us, whether you're on the front lines of healthcare for the homeless, or whether you're a training guy like yourself. Everybody has the power here to be able to do this.
Yeah, well said. So I want to kind of, because we're, you know me, I don't handle one big topic in 60 minutes. So let's do two, because the other thing, and I know, I've had conversations about Bobby when he was out in New York, had me talk to his staff about this. Barbara and I have done several trainings around this, but one of the things, the conclusions I've come from, and this comes from the research that I've seen where you got, physicians, nurses, social workers, 1, 2, 3 for the occupations that are impacted by burnout. That burnout is one of the biggest barriers to achieving our goals, whether that be organizational, whether that be social justice, is because, hey, I think all three of us would agree this fight takes a lot of energy to do. And the other thing that I'd be interested in hearing what you're seeing is, while there's this amazing amount of energy, I'm really afraid, maybe petrified would be a better word to use, that our healthcare staff and a lot of healthcare for the homeless, social workers are part of that team, mental health folks, there's a wide range of team-based care. I'm just worried that people are going to just start dropping dead in 6 months from now. And I'm not being over dramatic when I say that. Just the amount of stress people have been under. So I'd love to hear, because I've done 2, 3, or 4, I think 3 or 4 trainings around the country where I've asked people in a poll to say, where are you? And I've got this 4-stage level of burnout. And so you can be healthy or you can be on one of these 4 stages. The highest level of people that said they're healthy right now is 11%. Another one was 7 and another one was 5%. So 95% of this one group that I was teaching said, yeah, I'm burned out at some level. And I just kind of wonder what, through this time, because I think, like I said, well, it's kind of the social justice thing is, welcome to our party, we've been waiting for you. It also takes a lot of energy to do what we're talking about as well. So Bobby, let me start with you. What have you seen as far as the health of us, the folks that are trying to fight the good fight while, with the providers out there keeping people alive, fighting for housing, all these things that we're doing. Now there's a pandemic and this social justice revolution going on as well. How have you seen this kind of impacting people on the ground that you talk to?
Yeah, I think similarly to you, I just see a lot of stress, a lot of strain. I don't use the term burnout but probably that's what it is, or a great risk of it. And I think just there's a few things that have hit us at once. One is the extra strain caused by COVID, and how, especially in the beginning, so much was unknown. We didn't know how it exactly spreads. We were extremely concerned for people experiencing homelessness who would be more likely to be exposed, more likely to develop infection once exposed, less likely to get care, less likely to be able to implement the care in terms of washing their hands, or maintaining social distancing. So that was a strain. Then there was also the strain that some of your coworkers, you are at risk of getting sick.
Yeah.
And you are at risk of infecting your coworkers or your family or your patients. There wasn't tests available, so you didn't know. You didn't have PPE, so you could provide for yourself. You had to switch to a new mode of care, mostly telehealth. Some of your patients didn't have phones. You didn't know how to do this well. You hadn't had a lot of experience doing it well. You're figuring it out as you're going. Your clinic is seeing less visits, so they may have to close some sites because they have less providers, and you may have to work a double shift, or you may, and then, and then what, even before the spotlight shone on police brutality on May 25th, just barely a month ago, with the killing of George Floyd, in our clinics, the staff were feeling the pain differently. The lower paid staff, the frontline staff, maybe were not equipped to work remotely from home. It had to come into the clinic, and especially if they were from communities where they have to travel longer distances by public transportation to get to work. They are exposing themselves. They may go back to families that are multi-generational or more crowded, and then they're worried about infecting them. It was we had a learning collaborative on diversity, equity, and inclusion, 8 months long. The second one we've done focused on how can you help your organization implement these diversity, equity, inclusion, basically anti-racist practices. And we just had to just stop the agenda because the pain, especially among the women of color who were there, saying their administrators were not understanding that having a one-size-fits-all, say, even though I'm not frontline staff, but I should come in to show my support, that's having an inequitable, an uneven weight, burden that is exposing me to. And the pain was real. Yeah. So these are things we have to was all going on. And then we had the focus on police brutality and all this wounds and scars that reopened, and all the pain that came out, gushing out for people who had been holding it in, was just overwhelming. And fortunately for some, now it's turned to hope, because we see, hopefully, people are changing.
Yeah.
One important thing I need to add about the Healthcare for the Homeless movement that I think also helps to relieve this stress of providers is part and parcel, at the heart of our philosophy, our way of being, is that we include people with the lived expertise of homelessness as equals. And that is really what we do at the council, on our board committees, and also what we are helping to equip the Healthcare for the Homeless programs to do in their own program, make sure they are listening to people with the lived experience, the lived expertise of homelessness. And in a sense, that is therapeutic as well, because it brings you closer in a human way to those that you are serving, not as patient to physician, but as co-equals in thinking through how should we be operating our health center, what should our policies be. And when I was running a health center, that was always energizing for me and helpful for me to make sure that what we're doing is really effective for those whose opinion matters the most. Their opinion matters more than our funders, and to have that corrective and then to be able to respond is also therapeutic. And I think that's been an anchor that has helped some of our providers and our programs weather some of this tough time.
And I think, Bobby, you bring up a great point, which I've, kind of doing basically my own thing right now. I have a lot of discussions with myself, but they don't go very far. But one of the things that I think a lot of leaders right now are feeling called on is, well, how do I have these larger, the stuff going on in our community? How do we have those conversations in-house? And I think we have to be honest, and I think this may be a somewhat you experience with that great service you're in giving people voices. We have to be in such a healthy place to have a regulated conversation about intense topics. And I think that this is where I really worry about a lot of folks right now with being so burned out to sit around a table and let's say, well, how is racism impacting our organization? That is a tinderbox ready to explode on a good day. And so to hold that space right now, I'm hearing a lot of people wanting to have those conversations, but especially folks that are on the front line of the pandemic. I'm just cautioning to say you need to have that conversation, but you have to be honest with your staff is asking the question, do we have the energy to have this conversation right now? I mean, we've got to have it, but again, we don't want things to keep one person not at their best self at the table. Could explode the conversation in so many ways. And so I think a lot of leaders are trying to figure out the best way to have these conversations with a staff that's in survival mode because of everything they've been through too. So
yeah, and I think you have to create a space for that. I mean,
yeah.
If you haven't done it before, now's a hard time to have it, but it's better than ignoring it.
Yeah.
And you just really got to give space to staff if they want to opt out of it.
Yes.
Opt out of it. If they want to be there and be silent, let them be silent. If they want to avoid the conversation altogether for right now, let them avoid it. I'll say it's especially difficult for staff of color because you don't know how much has been repressed. I mean, and what the triggers may be that would not be for other staff that have not had some of those same experiences.
Absolutely. And sitting around those tables, I use this example because the organization was so burned out I was working for. This happened literally every 6 months is they'd hire some white guy out of college and send him shampoo shopping at a residential treatment center. Well, until this happened, I had no idea that Black ladies need different shampoo than white men do. Nobody told me that in my, 4 years of undergrad. So we'd send the sacrificial lamb off to go buy shampoo, and all of a sudden everything would explode. Now, it wasn't about the shampoo. It was about larger issues that we just didn't have the capacity to really talk about. But I think that that's such a good thing because on one hand, I do think if you're already at the edge of, call it the window of tolerance or capacity of stress, things are going to be experienced. It doesn't mean we don't need to experience them, but I also think people, on the other hand, get incredibly defensive on it as well. And so that's where leadership, I just see you've got to create that safe place and allow some of those cups to overflow a little bit and people to have their reaction where we continue to come back together and have these hard conversations. And we would be having a 2-hour-long discussion on just how to do that without a pandemic. So again, another big stressor there. Barbara,
if I could even just jump in. Oh,
yeah, I know. This is the longest I've ever heard Barbara be silent, Bobby. I don't know. You're the variable here, man. So Barbara, I'm gonna give you a long runway for this, and I want to throw in a little bit. One is sort of what you're seeing, but I also want you, like when you, because you come from that brilliant advocacy lens. Like I said, you have been my teacher, my mentor. I look at my work fully different now since you've been in my life. And I wonder, as you, I'm sure, encounter people that are in this state of burnout with your conversations and maybe trying to find the energy for advocacy, how do you help folks kind of see advocacy as maybe a component of their self-care, or if not that, maybe an energizing thing where they can actually bring motivation and stuff to the surface?
That is a tall order. And,
I told you I gave you a long runway. You've been quiet, so I want to reward you. You know, we've got about 13 minutes left. I'm giving you about 11 of them if you need them.
I think one thing, to even to provide a bridge to that, I kind of want to go back to this idea of what we're doing internally and how we're creating those spaces for staff, and how are we becoming healthy organizations that are anti-racist. And I think part of it is that all too often our organizations are just like any other collection of human beings. We have an attention span. And you just finished by saying, and we come back together to talk about these difficult issues. Part of the problem is that we often don't come back together to talk about these issues. It gets a minute for the organizational, space, and then, okay, everything goes back to normal, and then we're just moving on. And there's no real appreciable change, particularly for the staff of color who were really thinking maybe this is a moment where they're going to be serious about making some changes. And if you don't see changes, then that contributes to the trauma, the distrust, and then the burnout, and by not feeling supported by your own organization. And so when I think about our organizations becoming anti-racist and becoming self-aware and really dedicating a long-term space for this, not only are you able to engage your staff in being part of the community that you're building within your walls, but you are engaging your staff in the community that you want to build outside your walls. And so as you are translating your advocacy agenda toward these bigger picture legislative changes, either in the city council or down in your state's capital or in Congress, wherever, how is it that you are engaging your staff in a common vision for what you want to achieve, and doing that in a way that is inclusive and has a vision for really rectifying the wrongs that have been longstanding and making that explicit? And so I see this as a tremendously exciting time. And it's a time that's really got a lot of opportunities, because we've got a lot more people who are now paying attention outside the healthcare for the homeless community, outside our typical channels. People are wanting to get engaged, and they want to bring a new energy into this. And many people want to bring new resources into this. And so how is it that we can find the capacity within ourselves to open up our eyes and open up our heart to this broader coalition of people who want to see real change happen? And how are we extending our organizational advocacy agendas to include new partners, to include new people, and also making sure that the leaders of those initiatives reflect the communities that we're serving, reflect the communities that make up our workforce. And so how are we giving space to those new voices? And one of the things that I'm thinking through here is trying not to be disingenuous when someone comes home at the end of a 12-hour shift and you still have all your notes that you've got to do, and you've got your kids that you have to homeschool now, and you've got, like all of this is happening, and it sounds good, but wow, who has the energy? Because I think that's where the brass tacks comes to. And I think in some ways, looking at what we do in the healthcare for the homeless community, in the 100 different kind of facets of a view that we all have, how are we bearing witness to the injustices that we've long known about, the injustices that were just now kind of coming new to us, and then layering in this COVID piece? And how are we bearing witness and telling the story of what we are seeing? And so I think what we're asking folks, our providers and our patients alike, how can you tell your story and bear witness to what your experience has been, and tell that to people who can make change? And how do we create the opportunity to do that? And so that looks like creating discussion panels in communities where you have your elected officials present. It means making meeting spaces and phone calls and really demanding attention to a very specific list of, this is what we want to see happen. These are the budget decisions that we want to see. We're about to come up in this country and potentially seeing a pretty big wave of people experiencing homelessness. When evictions, if we don't take significant action, we're going to see a wave of evictions coming and creating a new wave of homelessness. Meanwhile, we've seen a lot of people who've lost their health insurance through disruptions in the workplace, and we've seen a lot of income that's been lost across families in this country and has not been replaced. That $1,200 didn't go far, and unemployment's starting to run out. And so how is it that we are banding together and we are seeing a common purpose across many different causes? And for so long, the powerful have been successful in dividing us. We end up fighting the disability community. We end up fighting the people who do youth and children, because we're trying to grab some scraps for the adults. And they have us fighting amongst ourselves over nothing, over scraps. How is it that we start to band together? We start to bear witness to what we're all experiencing. How do we tell story to power? How do we tell that truth and demand action? I think there's an exhilaration that comes from being recognized for what you have experienced. And I would love to see all of us, and the challenge to all of your listeners is, how are you creating the opportunity for those stories to be told? What does that look like? And it looks, podcasts and videos and testimony. I'm excited about the potential for that. So does that give you an opening for our last 6.5 minutes?
It sure does. And I will give you the question in advance, and I'll kind of answer it myself, because my thoughts on this, but how are you keeping your own self healthy throughout this pandemic? And the one thing I want to put out there that my work with Barbara and just watching Bobby be Bobby and all these great advocates, I tell you what, to be in Lafayette Square with both of you, I guess it's been over a year ago now, we were protesting there. So it's like the ghost of us, I think the energy was hopefully still there with those peaceful protesters that got violently assaulted by our government, but there's like, we've been there, we were standing ground there. We protested in the shadow of Christopher Columbus, a couple conferences back in DC, and it gives, so a lot of it is, I get energy from the moments I've had with you all. The other thing that I want to challenge our listeners to, because really helped me, is find the advocacy in your day-to-day work. Please, and I know the work is so hard right now, but to me, I just celebrate every day. I get to wake up and be part of the solution. I get to work for social justice each and every day in my own way by showing up to work. I actually, sometimes, not as much as I usually did, but I get paid to be doing my passion. And so I would really challenge, as my little self-care nugget for you around advocacy, just identify the impact that you have, because without you, we're not going to hit these big lofty goals. And sometimes it may just seem like we're keeping the ship from fully sinking because we're bailing so much water. But if everybody stopped bailing, we'd be in a lot of trouble too. So while some things might be frustrating in Denver, I was really pissed, and then I was happy, and then I got mad again about, like, all of a sudden, because those experiencing homelessness became a public health threat, we put them in hotel rooms. It's like, now I can celebrate and be pissed off about that at the same time.
Right.
But maybe that opens up those opportunities. So I think what Barbara, again, is teaching me is to really look for those availabilities. To be anti-racist is another thing that the speakers I've listened to have really challenged me to do, and just celebrate the work that you do each and every day. Bobby, do you have any, it can be a little tidbit, a big tidbit, how are you keeping yourself sane and healthy throughout this?
Well, and I won't get too metaphysical, but just to remember that we are spiritual beings as well, and to take whatever your spiritual practice, for mine is prayer, Bible reading, whatever it is, pay attention to that. Do not neglect that part of yourself. I am because of that, I am also an optimist by nature. So find the victories, hold on to them, celebrate them, and know that there can be more victories like that. And that's, I also, most days wake up and just am full of glad at the possibilities. Some days have been harder than others to do that, but yeah, just take care, not just of your body, your mind, but whatever that means to you, take care of your spiritual self as well.
Beautiful. Hey, Barbara, I'll let you follow that up.
And I will add in to say, taking care of your body as well, making sure you're getting good rest and good nutrition, and being mindful of what your limits are. I think being overwhelmed and stressed out and burned out, it's bad for your health. I think all studies would show. And so thinking through, what do you need to do to be spiritually and physically healthy? And for me, I know I have been working through a lot of yoga, a lot of meditation and breathing, a lot of walking in my neighborhood, and seeing people that I don't normally see because I'm not normally home during the day. and so I didn't even know what my community was like in the middle of the day. So that's a learning experience for me. And I think finally, thinking through finding the joy in the struggle for justice. It is a privilege to work in the healthcare for the homeless community. It is a privilege to be affiliated with everyone who does this work. And the joy that we find together in working toward a just community, and whether that means you finally figured out the right insulin that worked for your patient, that little thing, or whether it means that you've got a bill passed in your state legislature that finally is going to give higher wages to millions of people. There's lots of ways that we find joy in this struggle, but really this connectedness of a community and common purpose. There is nothing like the healthcare for the homeless spirit that goes through so many of people who do this work, whether they're formally healthcare for the homeless or not. I'm using that as a general framework, but just this idea that we are here together with common values and a common vision, and we are working every day in the role that we can, and bringing our best selves to this and bearing witness, and truly our presence creates change as well.
Beautiful. Well, I knew, one of my things that it's weird with this pandemic, but I've reached out beyond my typical social group. So I get to see friends like you, even though we didn't get to celebrate in Arizona together at the national conference this year. It's just such a beautiful thing to see you both. Knowing that you're out there fighting the good fight each and every day gives me hope. And so I want to thank you both for your work. So my listeners out there, if anything you do touches healthcare or housing, and you can be as creative as you want, you need to check out the National Healthcare for the Homeless Council's website, nhchc.org. I'll put that at traumainformedlens.org. There is a catalog of trainings. I even saw mine from a few years ago. We're still up there. They've got a great podcast as well. You can find Bobby and Barbara's contact information there. They are just a wealth of knowledge. I just had a common friend of ours, Dr. Deb Boren, attacked me, and I use attack very truthfully, after an HIV talk I get, and just shook me and said, "You are coming to the National Healthcare for the Homeless Conference next year." And my life hasn't been the same since. It has been so much better for having you all in it. So Bobby, Barbara, thank you so much. To our listeners out there, take care of yourselves. Yes, we need you. We need you healthy. Burnout also hurts your immune system, so we don't need to get sick. We need to stay healthy. Thank you both. Everybody have a wonderful day.